Morning, everyone, and thanks for joining us in the Faculties First COVID-19 webinar. This is really an opportunity for the Dean of the Faculty, Prof. Shabir Madhi, to just take us through some of the concerns that have arisen around COVID-19 in the workplace, and obviously the return to work. Prof. Madhi is going to be joined by Professors Lucille Blumberg and Professor Feroza Motara. Both are situated in some shape or form within the faculty. Prof. Blumberg is the Deputy Director of Epidemiology at the National Institute for Communicable Diseases, and Prof. Feroza Motara is the Head of Emergency Medicine within the faculty and is situated at Charlotte Maxeke Hospital. So Prof. Shabir Madhi, if I can hand over the discussion to you, please take it away.
So thanks, Antonia, and good morning to everyone, and thanks for joining us this morning on this, what is really a town hall meeting. My name is Shabir Madhi, as Antonia mentioned. For those of you that don't know me, I've just taken over as a Dean in the Faculty of Health Sciences, and it's really a pleasure for me to be taking on this position, more so during these challenging times that we're currently experiencing. So what we're going to be doing this morning is we're really providing an opportunity for staff as well as students to pose questions, especially to Professor Motara and Professor Lucille Blumberg. As you've heard, Professor Feroza Motara is based at the Charlotte Maxeke Academic Hospital, and she's really been at the forefront in terms of the management of individuals that have been hospitalized for COVID-19. Prof. Lucille Blumberg, who I've known for more than 25 years probably, is still at the National Institute for Communicable Diseases, and she's probably one of the most experienced people on the continent when it comes to dealing with outbreak responses. And she's served on a number of World Health Organization advisory committees with regard to outbreak responses as well as in relation to COVID-19. So we're fortunate to have two experts that have got sort of diversity in terms of the experience to assist us through the many questions that have been forthcoming with regard to concerns related to the return of both students as well as staff, and particularly to the medical school campus. So this webinar is less about staff that are needing to return or even students that are needing to return to the clinical platforms. That entails a different sort of discussion. We can engage in some of the issues surrounding that. But right now, I think the focus is around staff as well as students returning to the campus itself. And this has been precipitated because of what we've experienced in the past week, where a number of questions have been submitted to my office via Antonia in terms of concern of staff about returning to the campus. So as all of you know, currently we are on what is termed as an adjusted level 3 lockdown, which means that certain components of the level 3 are being enforced, and then there's latitude in terms of the other type of regulations that are sort of encapsulated in the level 3 lockdown in South Africa. And one of the regulations which is not really applicable in terms of what is considered the adjusted level 3 lockdown is to encourage staff not to come to campus, but rather to work from home. So that the adjusted level 3 lockdown, in fact, doesn't have restrictions in terms of the number of staff that should be returning to workspaces, not just at medical school, but any of the workspaces. So before going into some of the questions and the way we're going to conduct this, as I mentioned, I do have questions that have been sent to the office where people have requested we address specific issues. But in addition to that, we would also offer people an opportunity to raise their hands, to ask questions directly. And if you're not comfortable doing that, feel free to post the questions on the chat, and I will try to pick it up from the chat. So before opening up the discussion, what I think I would like to do is just to briefly touch on where we are in terms of the pandemic in South Africa, and most importantly, what is it that we can expect to occur over the period of the next 12 months, if not 18 months. So I'm not going to bore you with the detail of the numbers. I think most of you are familiar. We've now sort of reaching the 2 million mark probably soon in South Africa if we haven't passed it. I've stopped keeping track in terms of the actual numbers, to be honest with you, because even those numbers of 2 million is really an underestimate in terms of the number of people that have been infected in South Africa. And I think that's the first thing that we need to appreciate. COVID-19 and infections by the virus, the SARS-CoV-2 virus, has been much more permissive than is reflected in terms of the cases that are actually documented. And the reason for saying that is two important data points. The one is from the Cape Metro, where when they opportunistically tested blood samples, residual blood samples of people that were attending antenatal clinics and people living with HIV, at the end of the first wave, they indicated that in the Cape Metro, roughly about 40% of those individuals might well have been already infected with the virus. In Gauteng, we're just completing a sero survey, a household sero survey where random households are approached and tested for COVID-19. And this was done before the resurgence started. It's still ongoing. We probably will conclude it in a space of the next week or so. And the results from Gauteng were not too dissimilar from what it was in the Western Cape. In Gauteng, it was actually designed to look at what the force of infection had been, especially during the course of the first wave. And the findings for Gauteng is that on average, 25% of adults and children were actually infected during the course of the first wave. So that's 1 out of every 4 people. When you think that, when you know that Gauteng has got a population of about 13 million, so 25% of that basically exceeds the number of documented cases of COVID-19. So the circulation of this virus has been much more permissive than we've imagined, and certainly way beyond the actual number of cases that have been documented. Now, the reason why it's important to share these sort of numbers is that we just need to understand that despite all of the high-level restrictions that we had to endure during the course of 2020, in a country such as South Africa, because of the conditions under which many people live, the reality is that it provides ample opportunity for there to be transmission of the virus. That doesn't mean we need to become any more reckless or any less conservative in terms of our behavior to try to reduce the rate of transmission. But unfortunately, the reality for most respiratory viruses, and especially a respiratory virus such as SARS-CoV-2, for which the main mode of transmission and acquisition of the virus is probably by the airborne route, which basically means you can be in a poorly ventilated area and unknowingly you would end up being infected with the virus because that air is contaminated by these virus particles. And that is probably what has really contributed to a rapid rate of infection across the country, and also contributes to the type of resurgence we're currently experiencing. So keeping this knowledge in the background, I think it's important to appreciate that this virus is not going to go away during the course of 2021. Even with vaccines, it's unlikely that we're not going to see further resurgences occur during 2021, because the chances of us being able to reach out to significant percentages of the population in terms of being immunized during 2021 is fairly limited. I think South Africa will have done a remarkable job if we even get 1/3 of the population vaccinated during 2021. In addition to which, we obviously have got concerns as to how effective this current generation of COVID-19 vaccines are going to be against the variant that's currently circulating in South Africa, which is much more transmissible than the virus that was circulating in the early part of the outbreak in South Africa. So where do we stand as a faculty? As a faculty, I think we obviously have got responsibilities both to staff as well as to students. And the purpose of a university, as you know, is to provide opportunities for learning, for training, and for research. So those are the important aspects. And I think we would be fooling ourselves into believing that we are not compromising on those sort of objectives of the university if we aren't able to start understanding how best to start living with the virus in our midst. And again, to emphasize, it's more about responsible behavior that is going to assist us in terms of seeing through the rest of 2021 as well as we move into 2022. So with those few opening remarks, I'm going to now sort of if you do have any questions to ask, please raise your hands or post your questions on the chat and I'll take it up from there. So Lucille, Feroza, once again, thanks for joining us and let us get started with the questions that have come forward. Lucille, let me start with you. So the question here is that the manager of this individual expects the person to come to work every day, but the person is scared of getting infected and putting their family at risk. What should the person do?
So thanks very much, Shabir, and thank you for the invitation. We can work safely, and it's really about responsible behavior in the workplace and en route to work. Most infections, in fact, occur in the social setting and in the home setting. And I think if we observe the recommended preventive measures, we can be safe. So I think in a place such as a medical school where people are not working directly with patients, it is possible to apply these safely. But it's important to take all of these measures into the home setting and social setting. So working at medical school means if you are in the company of others, you absolutely need to wear your mask. And in the case of the workers at medical school, it's a cloth mask worn properly. And that provides excellent protection for people around you and also for yourself. But cloth masks are not worn properly. They're worn below the nose, around the chin, especially during the course of the day. So that's number one. And then it's distancing as much as possible. And I think in the medical school setting, where it's not overcrowded, it is possible to do that. And then, being outside when you are socializing, I think is important. It's that tea room, locker room, conversations over people's desks that are a problem. But most infections occur in the home setting, social setting, where because we know people, we know our friends, we know our relatives, we let our guards down. And that's where the problem lies. I think the workplace, especially medical school, can definitely be a safe place. Apply the rules properly.
Thanks, Lucille. And I think to sort of corroborate what you've indicated is that there's a number of staff as well as some students that were infected over the past 4 to 6 weeks. But most of those infections, in fact, didn't occur in terms of exposures at the workplace because many of those individuals were infected whilst they were on vacation, where people unfortunately become more complacent when it comes to adhering to the type of interventions that we know would reduce the risk of individuals being infected. So I think important message. And obviously people not coming to work doesn't mean that they're not going to be exposed or they're not at risk of being infected unless they're not moving out of the house. If they're going to the local spaza shop, if they're going to the shopping malls, that is where the exposures are going to take place knowingly or unknowingly. So thanks for that.
Yeah, and just Feroza. To add, I think transport is important. So people come in taxis. I think compliance now is very much better since fines are being imposed. Keeping the windows open, not overcrowding the taxi, and ensuring that everybody in that taxi is wearing a cloth mask properly over their nose, over their mouth for the full duration. Very important.
Yeah, so Lucille, thanks for bringing that up. And I think that it just reminds me that the other critical component in terms of the workspace is ensuring adequate ventilation. And if you're going to be needing to meet, rather meet outdoors. And certainly what we can't offer and what lends itself to people getting infected in the university environment on campus is if people decide to keep their tea rooms open and go to canteens. So over the past week, in fact, we've sent the directive out to all of the departments on the campus that all of those tea rooms need to be shut. I found it surprising that the tea rooms were still being allowed to operate and that the canteens were still allowing sit down. So that is a type of behavior that will lend itself to people getting infected. So it's about responsible behavior, and it's about being sensible, knowing now that this main mode of acquisition of the virus is through airborne acquisition. We need to ensure that people are wearing the face mask, especially when in groups, and to ensure good ventilation. Okay, Feroza. So the next question is, this individual frequently has mild and moderate symptoms of sinus problems, and the question is whether they should still come to work, and the person is concerned that people might judge them and think that they have COVID. So what would be your advice to someone that has got sort of allergic rhinitis and they have these flare-ups?
Okay. Thanks, Shabir. So just to add to what you and Lucille were saying, I think if the windows can be opened in the different offices at all, I'm not sure what the offices, in the building can do as far as that's concerned. But if we can open windows, that goes also a long way to improving or decreasing the risk. So as far as respiratory symptoms are concerned, remember, we all symptoms that we talk about in relation to COVID are dependent on whether you've had a contact or not, whether that contact was high risk or it was low risk. We use distancing, PPE, and whether the other person was positive or not as the criteria. So if you were within 1.5 to 2 meters of the person, that you weren't wearing a mask, and that the person that you came into contact with is known to have had COVID or is currently infected or has symptoms. So those are the things that you'd have to worry about. If you had your PPE on, if you had a mask, you were more than 1.5 meters away, you are less likely to be at risk, even though the viral particles are aerosolized and there is a risk. So your chances of being exposed are less. In terms of you having a chronic problem, I'm asthmatic and I'm constantly coughing. I constantly have to say to people I work with, guys, it's safe. I'm asthmatic. I do not have any other symptoms. I do not have any contacts, and I've always worn my PPE. So it's just reassuring people you work with, and possibly even informing your line manager, to say, I suffer from a chronic rhinitis, or I have an allergic sinusitis or something like that. And, that's why I have symptoms. That does not mean that you let your guard down. You still need to monitor your symptoms daily, like everyone else. You still need to check your temperatures, in terms of you coming to work, and your screening still needs to be done daily. Because even if you have an allergic rhinitis or sinusitis, you still can get COVID. So you still need to monitor for all those symptoms. But communication with your colleagues, with your line managers, reassurance, and talk to people. I mean, I know we don't like sharing our personal information, but in this instance, it's reassuring. Say to your colleagues that you work with, I'm sure people that you work with do know that you have underlying issues. The same goes for high-risk people, who have underlying medical conditions such as diabetes and hypertension and all those things. It puts you in a higher risk bracket, but speak to your line manager, minimize your interaction, face-to-face interaction with people if you can. The other big thing is to make sure that if you're dealing with students directly, where people are coming to your office all the time, to make sure that the students themselves or the people coming to your office wear their masks appropriately and have sanitized and are socially distanced when they come to you. So I think the bottom line is communication. Be honest. Don't hide symptoms. Because when you do and people find out, it creates a lot of angst and a lot of anxiety. So be honest, say, I have this condition or I have a problem. This is what's causing my current symptoms. And I am still currently screening daily and making sure that I'm not exposed or at risk. Thanks.
So thanks, Feroza. For those individuals that have this sort of chronic respiratory illnesses, allergic rhinitis, asthma, obviously, if you are concerned whether you might or might not have COVID, it's about looking for the additional signs and symptoms that are more suggestive of COVID than just the cough. So as an example, loss of smell or loss of taste sensation would be, and a fever certainly would be telltale signs that you might be having more than just a flare-up of your underlying condition. But like I said, like you said, the important message is communication, especially in people in your immediate environment, that this is the underlying problem that you've got, so they shouldn't become alarmed if they hear you sneezing or coughing. But that takes us to the next question, and this is one that's been posted on the chat, is that how long does it usually take for that loss of taste and loss of smell sensation to return? Feroza?
Right, so that there's no definite time limit, and there's no evidence that says it comes back in a week or 2 weeks or a month. I know of someone who's not been able to smell for 3 months post-COVID. So it does come back. That's the reassuring thing, both smell and taste. It's just varying degrees of time. So don't be alarmed, if it's taking more than 2 weeks or 3 weeks. There isn't a definite time limit for it to return, but it does. So just be patient.
Good. So, and I think the important thing there is that if you have these ongoing symptoms, it doesn't mean you're still infectious. And that is really important. So especially if you're not hospitalized, it's extremely unlikely that you will be shedding live virus after about 8 to 10 days, which means that you're no longer infectious and you no longer pose a risk in terms of infecting others. Lucille, so if the question is, if I've been exposed to someone with the virus outside of work, but I'm not showing symptoms, should I still go into work?
So if
and I think perhaps, Lucille, when you answer that, if you could also answer what the significant exposure really is, because we have these random exposures, but when should you really be concerned that the exposure might be significant and places you at risk of being infected?
So a significant exposure would be someone who's with less than 1.5 meters in distance from the person with confirmed or highly suspected COVID for a period of more than 15 minutes. And that 15 minutes might be cumulative over a short period, unprotected. That means not wearing a proper mask. So that would be a close contact. And people are most infectious who've got COVID in the first few days and 2 days before they show symptoms. We do know that there are people who don't have symptoms, and then you may not know that you've been exposed. So if you've had a significant exposure, you do need to quarantine for a period of 10 days, that's in the national guidelines. And during that time, you may not come to work and you need to distance yourself within the home setting from others and protect them from you. And during that time, you need to monitor yourself for the symptoms, as we've discussed, of COVID. And if you develop those, you need to be tested. So you will be deemed a contact and you need to quarantine. You cannot come to work.
Thanks, Lucille. So the importance is the closeness of the contact and whether there was any sort of protection in place, either the person or the person that's being exposed. So I don't think any random contact means that you shouldn't be coming to work. It's really the intensity of the exposure. So the next question is, I guess, from a student. Clinical students are part of the phase 1 vaccine rollout. And the short answer to that is that, yes, they are part of the phase 1 vaccine rollout. So the university is engaging with government as well as with hospitals in terms of getting our clinical students that have got exposure to the clinical platforms to be vaccinated. But as you know, there probably is going to be limited supply of vaccine. So there are different priorities within the healthcare workers in terms of who will be vaccinated immediately and who might only be vaccinated after a few weeks. But yes, the university is working with the government as well as with the hospitals to ensure that students that are needing to go onto the clinical platform will be vaccinated. Feroza, so the next one is, what happens if someone I work closely with gets infected with the virus? Does that mean I need to isolate myself, especially if I don't wear our masks all the time? And I think the answer to that question is that if you're not wearing a mask and you're at work and you're engaging with people, then that is irresponsible behavior. And that is exactly what is going to lend itself to getting people infected. So the starting point to answering this question is that there shouldn't be any circumstances that people have got a significant exposure in the workplace because they've been in close contact with someone that wasn't wearing a mask or they themselves were not wearing a mask. Feroza, anything else you want to add?
Yeah, no, totally agreed. As Lucille said, your risk of exposure is if you are closer than 1.5 meters, if you don't wear proper masking and appropriate PPE to protect yourself, and if it's a prolonged exposure. So even if you're working in an office and there's 2 of you, you should always be wearing your mask. The only time you take it off is if you possibly have to sit and eat, or, and then also ideally you should take your lunch, go and have it outside at the bottom where the canteen is. So there should be no reason why you don't wear a mask. I agree with you, Shabir, that's number 1. Number 2, should you happen to have that exposure, it needs to have fulfilled the criteria for a high risk exposure. Okay, so it must have been longer than 15 minutes. It must have been the close contact. And obviously, if you weren't wearing your mask. So not wearing your mask is a risk factor there. And you need to then monitor your symptoms. If the person is confirmed COVID that you're working with, then obviously you need to quarantine, as Lucille said. If they're not, and they're just also symptomatic, they need to have been tested and quarantined until they get a result. And you need to then, you can still come to work if you're not sure of the result of the other person, but you need to monitor your symptoms. So your screening is absolutely essential in that instance. You need to monitor your symptoms daily. You need to monitor your temperature at least for 7 days. And if the other person is confirmed positive in the next day or 2 after that exposure, you need to then quarantine as well and monitor your symptoms for the up to 14 days after that exposure. But as I said, the emphasis is on you have to wear the mask. It's not even a negotiable. You have to. Thanks, Shabir.
So thanks, Feroza. So Feroza, just to emphasize that when we're talking of exposure, we're talking of a significant exposure, which basically refers to prolonged contact without any sort of intervention being in place with someone that's infectious. Someone that's sharing the same, and Lucille, you might want to jump in here, someone that shares the same workspace who might have been infected outside of a campus as an example. And that workspace is shared with others who have all been wearing the face mask and there hasn't been that close contact. That is not the reason to go into quarantine, because that does not constitute significant close contact. So just to clarify that.
Yes. Agree totally. You need to confirm all this criteria.
Correct. Okay, so the next question comes from on a chat, and Lucille, you might want to take this. It seems that although the faculty is allowing for online registration where possible, there's a large number of visitors coming to the offices to register in person. What sanitizing and cleaning should be done over and above the standard cleaning that takes place once or twice a week?
So I think where there's a lot of traffic in an office, perhaps cleaning of surfaces once or twice a day is probably warranted. But we need to move away from considering that fogging. Fogging became very fashionable and quite a lucrative business. But fogging means sort of spraying all sorts of concoctions into the air in the hope that you will kill this virus that's in the air and on surfaces. But there's absolutely no scientific evidence to support fogging for SARS-CoV-2. The compounds that they fog, it's a bit of a mystery for some of them. It's a concoction. Many of them are not safe they're not effective, and we should not be wasting our time fogging and the so-called deep cleaning. The SARS-CoV virus is actually quite fragile. It's enveloped and it's very amenable quite quickly to being destroyed by very simple detergents, heat and chemicals. So, cleaning a surface means cleaning with soap and water well, and then applying a 0.05% hypochlorite diluted solution. That's all that's needed. We don't need this fogging. Even if somebody has had a COVID infection who's been in the office, we do not need to fog. Open the windows, simple cleaning, and applying sodium hypochlorite or 70% alcohol.
So thanks,
Shabir, can I just add something there? One of the important things is not sharing pens and paper and things like that they do. When people come inside, you come in, sign a register, and there's one pen there and the piece of paper, and those are often things that we forget about. When dealing with interaction with students, we want them to register. Ideally tell them bring your own pen, or provide a range of pencils or pens that can be cleaned in between, just wipe down. It's important because you touch things that someone else has touched and may have been exposed, and you can cause a mini outbreak like that. So just be careful with little things. Pens, having a register sheet that everyone's touching, that people can then take things, transmit things from one person to the other.
Thanks, Feroza. And obviously, it also emphasizes the importance of needing to sanitize both when going into the office as well as when exiting. But again, and it's not just about being infected with SARS-CoV-2. In fact, that should be good practice generally. For many other diseases, basically good hand hygiene would go a long way, especially in the health sciences, where often healthcare workers are responsible for infecting patients because they don't practice good hand hygiene. Feroza, another question perhaps for you. So this individual has got stage 4 kidney failure and wants to know whether it's fine to come to work. The person has been coming a few days a week for the past 6 months, but is concerned in terms of whether the new variant poses a greater risk to them.
All right. So remember, we've said there are high-risk people. There are people that fall into categories that put them at higher risk for not just getting COVID, but for getting severe COVID. And those people are older, usually male, people with severe uncontrolled hypertension, uncontrolled diabetes, any chronic immune compromising illness. So, if you're on chemotherapy, if you're on chronic dialysis, so you are at a higher risk. However, that does not mean that you can't come to work. It just means that you need to be put into a situation where you are going to be less likely to come into contact with a lot of people. So, for example, if you're doing student registration and you're the person that has the renal failure, then speak to the manager and say, look, I am a high-risk person. Please, could I be put into an office doing something less, sort of interactive with other people? So you can come to work. Obviously, your risk is also then in transport and in taxis and things like that. And it doesn't mean you can't work from home, depending on what kind of work you're doing. So I think even if you are a high-risk person, what we've done in the hospital, for example, is we've redeployed the high-risk employees into areas that are not COVID-related. So, there are potentially redeployment procedures that can be put into place. If you're doing a highly specific job and you are highly, you're doing, for example, an accountancy post, it's unlikely that you can do something else, but obviously less people interaction might be of benefit there. So there is no hard and fast rule that says you can't come to work. You just need to be additionally careful in terms of your interaction with people and in terms of your risk of exposure. So I think that would cover it.
And I think that would apply, like you said, for many other underlying medical conditions. So it's the same sort of principles. Thanks, Feroza. So just to go back to the previous question, and Lucille, I think the important point that you raised was there's very little role for deep cleaning and for fogging. And we need to focus on regular cleaning of the environment, not twice a week, but rather 1 to 2 times, twice a day probably.
Yeah.
And I think that's important to emphasize that there's no reason to be shutting down facilities to do deep cleaning, which is what has been taking place in some parts of the university, much to my horror. We know what's happened in Gauteng Department of Education, where they spent 430 million rand basically doing things that are going to have no effect in terms of COVID-19 in the schools. And we can't continue wasting resources and disrupting services by undertaking activities that simply don't have any value and are not going to assist us when it comes to fighting COVID-19. Lucille, how effective are cloth masks versus surgical masks? Are the disposable ones as effective?
So they do differ. When we started out with COVID, there was a great shortage of the surgical grade masks, and they had to be reserved for healthcare workers working on the front line. And that's really where cloth masks came in. They offer considerable protection from the COVID virus. They need to, however, be properly worn. I think that's the biggest problem. And I think good quality, 2 or 3 layers, although, I think there are many other face coverings that are permitted. I think the important thing is that cloth masks need to be worn by everybody to get the best benefit. They're most effective in stopping those mists of droplets with virus going out. And if everybody wears a mask, I protect you, you protect me, is really the philosophy behind them. But absolutely, they are very effective in stopping virus going out, and they have some effect on stopping virus coming in. But it really depends on everybody wearing a mask. So we all need to take that responsibility and point it out to people who are in the environment. They're cheap, they're affordable, I believe they are supplied by the medical school. They need to be properly cared for, they need to be washed and ironed or hung out in the sun. But they're reusable, they're cost effective, and they're highly effective. Surgical masks, can really only be worn once. And they're highly effective, but they are limited by availability, cost, and we want to make sure our healthcare workers have access to them when they need them. So absolutely yes to cloth masks, over the nose, not below the chin, not below the nostrils, and get a good fitting one. They're comfortable, they're effective, lots of attractive ones at the moment. We need to wear them.
Thanks, Lucille. And I think the emphasis is that you especially have to wear them when you're indoors or when you're in close proximity to others. When you're taking a jog in the morning, you do not need a mask. You're not going to get infected by breathing in good air.
No.
So it's about...
in a taxi, absolutely. Sharing a car with somebody, wear your mask, open the window. Sharing an office, in a shopping center, in a social environment at home, when your friends and relatives are visiting. Keep your distance, try and be outside, and absolutely wear your mask. That's where the infections are taking place, social setting.
So the next question is whether WITS is offering a testing service for staff, and if you think you may be infected. And I'm going out on a limb here. I don't think WITS specifically is offering testing services to staff. If people need to be tested, they need to make use of either the private sector, if they're on a medical aid, probably it's fairly expensive, or they need to make use of what's available through the public sector. But WITS itself is not offering that sort of testing facility. The next question I'm going to touch, am I expected to pay for sanitizer myself, or will the Faculty of Health Sciences cover it? The dispensers on campus are sometimes empty. So when the dispensers on campus are empty, then you need to report it to your line manager, or you need to report it to the operations manager. We are unable to provide every staff member or every student a sanitizer. In fact, that is something that everyone probably should be buying for themselves, because it's not only required when you're on campus, it's required for your everyday activities. So the Faculty of Health Sciences doesn't provide sanitizers to individuals, but there are sanitizers at key spots around the campus. And if those containers are empty, please take the time to report it to the operations manager or to the office of the operations manager so they can attend to it. Okay, Lucille, perhaps. Okay, so the next message is from Sue, which talks about a COVID app. It sends you a message saying that you have been exposed. Take care. What does take care mean?
Yeah,
okay.
it's a difficult one. There's many apps, and we've all had these messages, and you think, where was I?
So Sue, I think the short answer is that it doesn't really tell you much at all. The app has got some use, but it doesn't tell you whether the exposure has been significant or not, because it might be a random contact of someone else that has loaded the app that you walked past, and the app will send you a message that you are actually in close proximity to someone that was infected. So it's pretty useless in terms of advising you as to whether you need to do anything. Obviously, if you become symptomatic, you need to be tested.
It also creates a lot of panic, Shabir. Sorry. We've had a few people that have come through and just said, I've got this message and I need to be tested. And again, it's about putting it in perspective.
So I can openly declare that I have not downloaded the app, and I've got no intention of downloading it because it doesn't serve any sort of purpose in South Africa, in our context at least. It's got different purposes in different environments, but and when there's very few cases in a country, then it might be of some use. But when there are millions, hundreds of thousands of cases, individuals that are probably infected, and not even 10% of them have downloaded the app, it really doesn't tell you what exposures you might or might not have had. So the next question, Feroza, to you, if one has had COVID but is no longer infectious, that is, they test negative, but they're still suffering from symptoms, should there be any sort of different screening tools used for that individual? So we've been asked to complete this app every day, which is symptom-based. And what is the approach to someone that has recovered from COVID? And like I said earlier, if you 10 days after the onset of symptoms, you're probably no longer infectious, but you can still have these ongoing symptoms. But what should the approach be in terms of completion of the app? Because it's going to flag you as being symptomatic.
Yes. So I think those are the exceptions rather than the rules. I agree with you. 10 to 14 days at the most is, when you're no longer infectious, and you should be safe to come back to work. But again, escalate to your line manager or to someone who's dealing with the screening to say, I've had COVID, I've cleared my 10 days, I'm gotten a letter from my doctor, I'm fine to go back to work. Just note that I still have ongoing symptoms, because as we said, you lost your sense of smell or taste. It can be there for 3 months or 6 months. And, then that doesn't mean that you can't come to work for those 3 or 6 months. You can still carry on as normal, but it needs to just be communicated to someone. One of the things that you need to remember is that the people dealing with this, the line managers and the people that you are involved with, need to also have a certain amount of understanding of these things. Because if you say to the security at the gate, I've still got a sore throat and I still can't smell 2 weeks or 3 weeks after I've had COVID, he's for sure not going to let you in. So we just need to find a way of getting that information communicated. Lucille, you wanted to say something?
Yes, we don't routinely test at the end of the isolation period. We simply use the 10 days to as a cutoff for being non-infectious. In fact, it's probably from 8 days to come back to work. So there's no end of isolation testing.
Yeah, thanks. So Lucille, perhaps the next question. So what would you advise for individuals that are working in offices where there's minimal ventilation, would it be acceptable to work from home? I can take this. In fact, let me answer this. So when we're talking of ventilation, your office doesn't necessarily need to have windows. If it's got windows, keep those windows open, keep the doors open. It's that there's very few places on the campus that doesn't have good ventilation. And if you're concerned about the ventilation in your workspace, then you need to speak to your manager, and the manager needs to reach out to the operations manager, if need be, to see how we can optimize ventilation. That is not an excuse not to be at work. It's things that the university needs to deal with to make sure that the space that you're working in is a relatively safe space, especially in terms of ventilation in the context of COVID. So that would not be a reason not to work from the campus itself. Lucille, how safe am I at work? I thought large crowds and congestion were bad for the spread of COVID.
Well, you're right. People who congregating in unventilated areas, particularly if they're not taking any other precautions like masking, is absolutely a risk. But I think, we've spoken extensively about reducing those risks and not having a crowded working space. And I think for many at medical school, that is absolutely the case. They can spread out, have to wear masks, improve the ventilation where necessary, and sanitize and clean your desks. So for most people at medical school, that is not an overcrowded working space. And I'm sure the dean can confirm that. It's the tea rooms, it's the social gatherings at work, it's the sometimes the transport, and then the home setting where this crowding really is an issue. Yeah. And it's gathering in little huddles at work. We're sociable creatures that we really need to avoid. We can distance, it is possible, but we forget.
Yeah, thanks, Lucille. And I can vouch that the density of people on the campus right now is about 24 less than the density of people when you go to a shopping mall or to your local spaza. So there really isn't overcrowding right now. And it's about responsible behavior. So even if we have a higher density of people, people are going to get infected if they start congregating and not wear their face masks, and especially when they start congregating indoors. So it's really about responsible behavior. So next question I'll deal with. So what are the recommendations regarding the use of venues such as boardrooms for in-person meetings, as well as lecture theaters for lectures? So the university is unlikely to allow for the use of lecture rooms for lectures, especially when it involves hundreds of students. That is not going to happen in a foreseeable future. And that's the reason why we're going to this hybrid model where much of the learning content will be posted online, coupled with some breakout sessions for students that might want to have some face-to-face contact, but that will be done in much smaller groups and it will be more focused. In terms of boardrooms, there's no reason not to have in-person meetings. We need to try to minimize it, but at the same time, if we do have those meetings, we need to be responsible in terms of behavior again. It's about good ventilation. It's about people wearing the face mask when they're in that vicinity. Perhaps if you're speaking, take it off, but put it back on. And it's about the physical distancing. So we're not going to have meetings where there's 100% occupancy in the space that we're meeting in. We need to ensure that the occupancy is limited to at least maximum of 50% of the maximum occupancy. And it's also about how we structure the seating in those spaces. Okay. So let me just next question. So Lucille, maybe Feroza for you. Who is classified as a frontline healthcare worker? Does this include professional admin staff who engage with students on a clinical platform? Feroza, perhaps let me just take this for you. It's a quick one, and it's more university related. So the frontline healthcare workers are individuals that are going to have in-person contact with probable cases of COVID-19. Those are your frontline healthcare workers, and especially individuals that are directly involved in the care of COVID-19 cases or investigation of COVID-19 cases. So that will be your first frontline level of workers. Now, the other healthcare workers, even on a clinical platform, there's different sort of priorities in terms of when they're likely to get vaccinated. In terms of the admin stuff, I think, again, we need to appreciate that your exposure to COVID is not just because you're in contact with people that are on a clinical platform. Your exposure of COVID is much more broad than that. Like I said, when you go into a shopping mall, every person that's passing you is a potential person that could be spreading the virus if you're not careful. So right now, in terms of what will likely be available to South Africa in relation to vaccines, office-based staff are not considered to be frontline healthcare workers or not considered as priority groups for COVID vaccination during phase 1 and possibly not even during phase 2. Things might change if vaccines become more available. Must I wear a mask the entire time at work? I think we've dealt with that question. So the next question is, what are the chances that we will be able to move back to teaching face-to-face this year, or should we assume that we'll be teaching online? The short answer to that is we need to plan for teaching online for the rest of this year. We might need to create environments that allow for some students to come for face-to-face contact, because we can't compromise our responsibility in terms of offering good opportunities for students to gain experience and gain exposure with their teachers and their lecturers. So it's going to be a hybrid model, but we're unlikely to basically move to large classroom type of activities. It will be more focused. Okay, we've dealt with the issue of deep cleaning and sanitizing and the futility of that. So I'm going to take that one off. Okay, Feroza, when restarting patient sample collection for research purposes, should COVID positive patients be an exclusion criteria due to a lack of knowledge of what aerosols our experiments may generate? Well, I think we've got good idea in terms of how the virus spreads. We said the main focus is around airborne transmission. And even if doing this sort of research, you need to take the necessary precautions in terms of preventing infections. Okay, Feroza, perhaps for you, shouldn't we have a more effective screening mechanism for COVID? The app doesn't really work, as you can lie about symptoms and no one will know.
Well, that's the bottom line, isn't it? Is that this entire process depends on you being responsible, you being honest, and you putting yourself in the situation that potentially you could be spreading COVID to other innocent people. So the bottom line is that it's the best we have at the moment. It does cover all the symptoms. We've already dealt with the situation where you're recovering and still have, or recovered after your 10 days and still have symptoms. But for the rest of us, it's absolutely essential that you be honest. Because if you lie and you come into an environment where there are high-risk people in terms of their comorbidities or age, and you then expose that person, you're responsible for causing a mini outbreak or possibly even someone's death at the end of the day if they are high-risk people. So the bottom line is that every single one of us needs to do it diligently and to do it honestly. And if you have got symptoms, then take the necessary, routes in terms of what you have to do to be safe. Report it to your line manager, quarantine if needed, if it's a high-risk exposure. And if you develop symptoms, have a test. That's the bottom line. So it doesn't matter what screening tool we use. It depends on every single one of us being honest and being open and discuss what or disclose what we're being exposed to.
So we sort of running out of time, but we've got quite a few questions, so we're going to try to rush through them. So the messenger RNA vaccines that are being developed for COVID, will they be effective against the new variant? The short answer is we don't know, either for the messenger RNA vaccines or the vector-based vaccines. But in South Africa, we're very likely to get results from at least 2 or 3 different studies, literally in the course of the next few weeks, as to whether they protect against COVID-19. So it seems that the School of Public Health did a survey looking at ventilation in common spaces and classrooms, and they've been able to use that to set maximum occupancy of the rooms. in addition to distancing conditions. So I think that's a great initiative. Derek, if I can ask you to actually, in fact, I'm going to ask Antonia for Lee to get in touch with you so that we can do the rest for the rest of the campus if it hasn't already been done. Lucille, can the virus be spread through air conditioning?
So that's an interesting one. I think it depends on the type of air conditioning and how many exchanges there are and the efficiency. I think you have to look at individual air conditioning systems and make sure that they comply with what's recommended. Windows, open the windows.
Yeah, and we're actually asking the operations manager, Lee, has been actually looking into this to do an evaluation of all of the ventilation that's in place, all of the air conditioning systems that are in place in the campus to make sure that they are compliant.
I think while you're looking through, just to mention that the new variant is prevented by the same measures as the original virus. It's the same protection, but just be more compliant.
Okay, if one contracts the virus at work, what should be done to access the benefits? For that, you obviously need to report it to HR, and HR would be responsible for sort of assisting you in terms of claiming whatever benefits that might be due to you. Okay, so the next question, there often seems to be a difference in expectation from the broader university and our faculty with regards to working from home. Currently, the university says that those who can work from home productively should do so. Okay, so I'm going to answer this. In fact, there was a meeting of the senior executive team yesterday to address this, and there will be a correspondence that will be coming out from the university in terms of what expectations are of staff. The reason why the Faculty of Health Sciences does differ from the other faculties, firstly is because our students are returning much earlier to campus than other students. For most of the other faculties, the students are only returning sometime in March, whereas our students have already started to return since the second week of January. So we can't apply the same sort of approach as other faculties might choose to do in relation to the need to have staff be sort of in place to assist in terms of the returning students. Okay, is there a plan to work with Department of Health and NHLS to ensure all healthcare workers will be covered? I'm not too sure what that exactly was. I assume that refers to vaccine, and the answer to that, if it refers to vaccine, the answer is yes. Feroza, okay, this is probably for Lucille. What are the socioeconomic and political factors that may be responsible for changes in recently documented mutations?
Ooh, I think that's a whole different webinar on its own.
Yeah, I don't think I don't think there's any socioeconomic and political factors at play. I think this mutation in South Africa has arisen because of the high force of exposure that probably took place and the immune pressure that the virus has been under. And it's actually that immune pressure which sort of expedites these types of mutations to take place to assist the virus to continue surviving. So it's actually a mutation which the virus needs to undergo to continue surviving in a sense. But that's a much bigger issue which we're not going to be able to make justice to right now. Okay, the plans that we're getting from schools for now indicate our children will not be going to school every day. They will rotate school attendance on a daily or weekly basis. What do we do with our children who have to stay at home? Unfortunately, this is not unique to the faculty. And I think it's a completely different issue. The bottom line is that we need to start learning how to live with the virus, and we need to adapt our lifestyles and our plans in that. So it doesn't really assist you in terms of giving a direct answer because there isn't a direct answer to it. Will test and exam venues be available for small groups? The short answer to that is yes, provided there's adherence to the non-pharmacological interventions and that we're not overcrowding spaces and there's good ventilation. Okay, what constitutes a small group? There's no magic number to a small group. It depends on the space itself. It depends on the type of ventilation. It depends on what type of distancing. Lucille is stretching out her hands there. So that it's not about the number of people, it's about the space and behavior of individuals in that space, and the type of spacing that can take place between people. Is it sufficient to only wash clean hands when returning home? Or would you recommend the change of clothes and even a shower? So I think a short answer to this is that initially when we thought that the virus was mainly spread through direct inoculation or contact with contaminated surfaces, then we were more concerned about the needing to take a shower and change your clothes and everything else. But now that we know that the main mode of transmission of the virus is by airborne route, those sort of measures are probably an overkill. It's probably a good to have, and you should rather not do that than risk focusing on those sort of interventions that probably do work. Okay, the vaccination rollout where healthcare workers could volunteer. The university is not yet been asked to provide any assistance in terms of rollout of COVID-19 immunization, but if they are, we'll reach out to volunteers. Must employers maintain confidentiality of positive employee in tracing close contacts? So this is another big issue that has arisen in a university where some staff have insisted that we name people who have been infected and who have died of COVID-19. And that is a problem at multiple levels. And in fact, it's counterproductive to be doing that because firstly, it doesn't tell you much about whether you've had a significant exposure to that individual or not. And it also brings about some sort of stigmatization, which we're wanting to avoid. So the university is not obliged to do that. They are sort of obliged to investigate the cases to determine whether those infections possibly took place on campus and what the significant exposures might have been to others. And in that instance, they are obliged to let the others know that they might have had a significant exposure. But this is something that's dealt with in occupational health. So,
Shabir, sorry, just ethically and legally, you are not allowed to disclose patient information and names. So I agree with you. I think people need to understand that they will be told about the risk and that if they have been exposed, but disclosing people's names is definitely a no-no. Obviously, if the patient themselves wants to come out and say, guys, I've had COVID, that's a different story. Thanks.
Okay, thanks. Lucille, Feroza, any concluding remarks before we bring this to an end?
Yeah, so just to say, we can work safely at medical school and apply all the protection and preventive measures in your home, social, and other activities that we've spoken about today.
Totally agree with Lucille. Just one other thing, I think if people have questions and you sitting with anxiety in your own office or at home, reach out to someone. They're healthcare workers all over the place. They're people at faculty. Rather clarify the issue instead of letting it brew and you sit there and you worry and you're anxious and you're doing the wrong thing at the end of the day, but you're not sure. So I think most of us are happy for people to contact us, obviously not at 3 o'clock in the morning if you have to, we're happy to field those questions and reassure you and give you. And I think the important thing is to get factual information and evidence-based information rather than just the local WhatsApp group that's spreading the next conspiracy theory. So I think just take that into mind as well. Thanks, Shabir.
Okay, thanks. So thanks, Feroza, Lucille. And that's bringing us to an end to this sort of town hall meeting. And I hope that those that had an opportunity to attend found it useful, that it has clarified whatever concerns or questions you might have had around COVID-19. Obviously, these questions are going to continue arising, and via Antonia, my office is open to staff as well as students. If there are any questions and any issues that you're wanting to bring to my attention. So once again, thanks for joining us. Keep safe and look forward to working with each one of you during the course of 2021 and beyond. Thank you. Goodbye.
Thanks, Shabir.